Talking health insurance now, because we've got new data out from Dubai, from the Dubai Health Insurance Corporation, which is part of the Dubai Health Authority. A new report out. We don't have a massive amount of comparative data, but here's what we know. Last year, 22 billion dirhams worth of claims went through that system. And that works out at an average of about 500 dirhams per claim. We don't know what it was in 2022 or 2021, but it's still, it's a big number, but it works out about 5% of GDP, which is actually quite a small number. We know people care deeply about health insurance. So Stephan MacLaren's with us in the studio. Stephan MacLaren, Director of Corporate Solutions, 7 Insurance Brokers. Stephan, good morning.
Good morning, Richard.
So let's talk about this data briefly. What was your takeaway?
I think it's clear to see that the transactions are increasing all the time. From my anecdotal conversations with healthcare providers, they're jam-packed full with patients. So I think there's definitely an increase in terms of activity in the medical insurance world.
We've got comments that I was reading from the Emirates Insurance Association. Fareed Lutfi there is one of their heads, and he reckons health insurance premium inflation in the UAE is between 5 and 10% a year. And I've heard figures like that, 8% as well from the industry. What's your best? It's more than a guess, your informed opinion.
I would say it's over the 10%. There are surveys out there. There's some large brokers like Alphatine Willis, under Willis, Aon and Marsh that do annual surveys, and it's somewhere between 9 and 11% typically. It depends where the data comes from, but overall I would say it's definitely into the double-digit figure and has been consistently for the last 10 years. COVID dipped it a little bit, but overall that's the sort of figure.
Are we claiming too much? And I'm more guilty than most people about this. But the number of health insurance claims through Dubai last year was 44 million. Now, I don't have a precise figure for residents of Dubai, population, 2-3 million. That's about 11, 12 claims per person per year. That's a lot, Stephan, is it not?
The short answer is yes. I certainly think that the claims data that I get as a broker should be more about how many times does the membership actually go and see the doctor. That 8 or 9 times is not something I'm surprised at all. We don't need to see the doctor that often. So I think there's no perfect healthcare model, but medical insurance, because people are insured, allows the medical facilities to say, come in, fill your boots, don't worry, the insurance company is covering it. So I think that's part of the evidence of what's going on. And yeah, going to the doctor too frequently. We spoke earlier off air, try and avoid going, get fit. Prevention is better than cure. Brandy Scott's not here today, but she would say something like, better to build a fence at the top of the cliff rather than have an ambulance at the bottom of a cliff. But the incentives of the insurance company, once you've paid your premium, and if you've paid quite a lot, or if your employer has, you think, well, I've got it, so I'm going to use it. So are the incentives wrong there? I think one of the problems is that each medical insurance policy is done year by year. In an ideal world, which is very hard to find, is to get a plan where insurers could have a policies that make it more sustainable, spend more on wellness and prevention. Because if you look at most medical insurance policies, there's not a lot in there about prevention. And in discussions with clients, it's not a topic that crops up unless that particular person is into wellness and prevention.
Let's talk about health insurance for older people in particular, because rising insurance costs are a problem for fit young people. But if you're retiring here as an expatriate, it really is an issue. We had a comment. Someone reached out to me actually on LinkedIn just a couple of weeks ago to explain that their medical insurance bill had gone through the roof. I'm not going to give you his name. He lives in, Neil, I'll give you his first name. Lives in Ras Al Khaimah, and this is what Neil told us.
I'm currently 63 years old and my wife is 61-year-old. We have no ongoing health issues. We're both fit and healthy, exercising regularly, etc. Recently, I received the insurance renewal for the coming year, and we are facing an 80% increase in the premium. I really feel, as older people in the UAE, we are being penalised and just some arbitrary figure applied to our premium.
Now, Neil says he did have an accident last year, so he did make a claim, but 80% is significant. Just before I get your reaction, Stephan, listen to this as well. This is Dr. Azad Mupan, who you know well. He's the founder of Asta DM Healthcare, one of the big insurance groups here. We spoke to him a couple of weeks ago about trends for 2024, and he said, particularly for old people, he didn't really have many words of comfort for people like Neil. This is what he had to tell us.
It's going to be definitely more expensive. When you look at it, it's a 80-20 rule. 80% of all your healthcare expenditure will be paid during the last 20% of your lifetime. So as people get old, more and more expenses are required because you get one illness over another and over another. People, as they age, the cost goes up significantly.
Cost goes up significantly. So what can we say or do for the Neils of this world? He says he walked 45 kilometres in Ras Al Khaimah this weekend.
First of all, Richard, I'm not surprised that there was an actual accident or some sort of claim, because what typically happens for individual policies is whatever you claim as an individual, as a family group or on your own, that will just be lumped onto the following year's premium. So the chances are he claimed, a little bit, quite a bit more than what his premium was. It's just why it's lumped in. So if we start off with insurers are not a charity, they're trying to make money. So that's the starting point. What I think we need to do here in the UAE is the government wants people to retire here, is to get some sort of legislation where there's a pooled fund for retirees. I'm going to say it's almost like a national health service in a way. It could still be an insurance model, but each individual is not having claims affecting the following year's premium, because otherwise this is going to go on all the time.
Isn't that the very nature of insurance? It's about pooling risk, isn't it? Even with a private company. Is that happening at all here?
Not much at all in individuals, and that's exactly the problem, Richard. People's perception, particularly we're all here from the UK, is that it would be a pooled risk. We're not having that. It's effectively your own money managed by an insurance company to look after your medical health, and they're trying to make money on top. So the model needs to change if we're going to have a sustainable retiree future for people here.
But that would need some kind of government legislation, regulation, call it what you will.
I mean, you could get some bold insurance companies that would try it, but the problem would be is that if you've got some people that are claiming a lot and others that are not, some people will feel they're missing out. So it's that chicken and egg situation. So I personally think it's got to be a government-led or legislation-led pooled fund available for retirees.
So if you've got one insurance company that does this whole pooling of risk, if you've got dodgy hips and you think, I'm going to need a hip replacement in the next couple of years, you're going to go to that insurance company.
That's the problem.
So it's all or nothing.
Yeah.
Prisoner's dilemma, microeconomics 101,
and
call it what you will.
Yeah, there's so many companies out there like Insurance Market, Policy Bazaar, I had it advertising before, other companies out there doing this aggregating site, and just you can swap and change insurers when you wish. One of the other big problems as an individual is when you start to claim, particularly in retirement, you have to disclose that if you move to another insurer. So you're getting that noose around your neck to an extent as well. So it's really tough, and that's why I think it needs legislation support.
Finally, 30 seconds. We don't have that pooled insurance scheme yet. Hopefully, maybe one day. 20 seconds. What advice could you give to the Neils of this world?
One of the things I could suggest is just take an absolute basic policy. So if you're going to see a GP, you pay that cost yourself to most of the time, and then take out an inpatient policy on top, which is just for the serious stuff. So that's perfectly possible and allowed to do in Dubai.
Stephan MacLaren, good to hear from you. Thanks for joining us this morning. Director of Corporate Solutions at 7 Insurance Brokers. It's the Business Breakfast, Dubai Eye Radio, Dubai One Television.
Dubai Eye 103.8.
Join the conversation.